Lots of parents are concerned when they're told that their child needs to have a urinalysis done by a straight cath. And so I try to talk them through it to make them understand why a catheter needs to be done and not just get a bag UA. So usually I try to acknowledge their concern and say, gosh, I know that that sounds scary, right? The whole idea of a procedure just to obtain some urine sounds really frightening and sounds painful and all of the fears that parents have. And so I try to talk through that a little bit and really explain why, that in fact, if we do just a bag specimen, we could get that contaminated with lots of other germs from the GI tract, and that could really ruin our results. And so the most important thing for us to do is to get the right test done as quickly, as efficiently, and as most comfortably as we possibly can. And that way is by doing an in and out catheterization. And I try to really explain it in very simple terms, that we're going to clean off the area where the urine comes out and insert a tube that goes up into the bladder to collect a small amount of urine, and then it comes right out. And when that's done in a sterile fashion, in fact, that gives us the truest results so that we can do what we're all here to do together, which is make your child feel better, to understand what's going on so that we can fix it right away in the best way possible. And usually when I explain it that way, then parents understand. And while they may not like it, they support the choice. They're actively engaged in being part of the decision making and part of the management too. So that's been something that's really worked well for me.